Here at the University of Pittsburgh School of Pharmacy, our SNPhA chapter is looking to stop cancer in its tracks with the HPV vaccination, the red light to cancer. What is HPV and why is it so important we do something about it? The human papillomavirus is a sexually transmitted infection that is spread through skin-to-skin contact. According to the CDC, almost 80% of the human population will be exposed to the virus at some point in their lives. Most people naturally clear the virus within a few years. However, it becomes a problem when they don't. When HPV lingers in the body, it can begin changing our cell structure from normal to abnormal, leading to many health complications. Untreated HPV can cause genital warts and several cancers. This includes cancers of the tongue and back of throat, cancers of the cervix, vulva, vagina, and cancers of the penis and anus. But we can put a stop to all of this. The HPV vaccine is key to cancer prevention. The vaccine protects against many types of HPV that cause these complications. With the HPV vaccine, it's as simple as 1, 2, 3. The 3-series vaccine spanning over 6 months will protect against up to 9 types of HPV and is recommended for 11 to 12-year-olds. The HPV vaccine is recommended for both males and females. However, national vaccination rates for everyone are quite low. In 2014, the CDC reported that only 41.7% of the country has received at least one dose of the HPV vaccine. These rates are well behind those for the Tdap and meningococcal vaccines. Nationally, male vaccination rates continue to be lower than female rates. The Federal Department of Health and Human Services set a goal of 80% vaccination rate nationwide. When we look at the Allegheny County-Pittsburgh area, our HPV vaccination rates are particularly alarming. Data obtained in 2013 from various health insurance companies shows that only 15.6% of eligible females have received all 3 HPV vaccination doses. Even more surprising is that only 8.3% of eligible males have received all 3 doses. This shows that there is much room for improvement in the Pittsburgh area. So, we here at SNPhA have been working hard to tackle this important public health problem. To educate and increase awareness of HPV and the vaccine to the catch-up population, our SNPhA chapter has been working on interactive health fairs in dormitories to reach University of Pittsburgh students. So far, we've reached out to students in dormitories and popular campus buildings. During these events, our goal is to educate the catch-up group of 18 to 26-year-olds. Males can receive the vaccine up to the age of 21 and females up to the age of 26. By reaching out to college-age students who fall in the catch-up population, our goal is to increase awareness of those students who still have not received the vaccine, motivate students to take charge of their health, and get vaccinated. In order to gain a baseline understanding of student attitudes and knowledge gaps about HPV, we conducted online surveys where we reached over 600 students from August to November of 2014. Our next steps were to utilize the survey results to focus on the educational needs of Pitt students for our health fairs. By March of 2015, we launched our pilot educational event, which received a positive response and allowed us to continue with more events and follow-up surveys to understand what students gained from such events. We continued hosting educational fairs in campus dormitories throughout the fall of 2015 semester. We also had a special HPV documentary screening in October to reach out to students about the importance of the HPV vaccine in a unique way. After these successful events, we are excited to continue our community outreach throughout the spring of 2016 to keep increasing awareness of HPV and what people can do about it in our communities. In October 2015, we held a screening of Someone You Love, the HPV Epidemic, a powerful documentary that follows the lives of 5 women affected by HPV. As students gathered to watch the film, they gained knowledge about what exactly HPV is, its consequences, and how the vaccine can protect them. They also got to see exactly how debilitating HPV can be for the physical and emotional state of those affected and their loved ones. Our attendees were then able to engage in an interactive health panel after the showing of the documentary. Students asked questions and learned from a physician, a pharmacist, and a cervical cancer survivor well-versed in the topic of HPV. Because of the overwhelming response after these events, we at SNPhA are incredibly motivated to continue our community outreach. If we were awarded the SNPhA's Prescription for Service grant, we would utilize the funds to expand our HPV vaccination initiative to empower as many students as possible to be aware of HPV and the importance of its vaccine. Specifically, we would spend approximately $900 to purchase materials to further expand our successful dormitory health fairs. Additionally, we aim to increase the amount of feedback we receive after our educational events to gauge the impact we are having in the community. Approximately $500 will be allotted to help increase survey response. Because of the positive response to our HPV film screening event, we would also allot the remaining funds to host another interactive gathering where students can freely discuss HPV and the vaccine. Since the project's conception, student and faculty responses have been very positive, and we hope to continue to meet our objectives through interactive and educational events so that students can continue to learn about HPV and become empowered to protect themselves. The health complications associated with HPV is preventable. We do not need to suffer or see loved ones suffer from cervical cancer, genital warts, and other complications. We here at the University of Pittsburgh SNPhA chapter will continue to be the voice that encourages our peers, the catch-up population, to take charge of their health and advocate for the community by sharing how the HPV vaccine is the red light to cancer. Our project has been a combined effort of our SNPhA members and a few particular individuals who have helped us immensely. We offer special thanks to Kaylee Hayes, Dr. Carolyn Thorpe, and the Jewish Healthcare Foundation.